Hello everybody, welcome to the PAWFestival. I'm Dr. M. I've been a practicing veterinarian since 2012 and I am honored to be able to present a lecture to you today about common emergency issues that you need to see a veterinarian for right away. And the information in this video is incredibly important for every single person who has a pet to know, and I hope that you enjoy learning something today. All right, let's get started. A very common thing that we will get questions about is whether a pet who is vomiting or having diarrhea is an emergency. So here are some things to consider. One, has the vomiting and or diarrhea been going on for any significant period of time? Like, there's a difference between a pet who has vomited once or who has one diarrhea bowel movement and then is otherwise eating completely normally, acting normally, playing normally, drinking normally, there was no blood in the vomit or the stool. You know, that type of pet who's had one incident you could likely monitor for a little bit. This is in stark contrast to the pet who has blood in their vomit or in their stool, or a pet who has lost their appetite, a pet who is acting tired, a pet who continues to vomit or have diarrhea, who doesn't want to eat. That sort of a pet needs some intervention. Your veterinarian will need to do an exam to try to rule out some of the causes of vomiting or diarrhea. They may recommend some imaging, like an x-ray or an ultrasound, to look for foreign bodies, to look for inflammation through the GI tract. They may test for parvo, they may test for different intestinal parasites. It will all depend on what's exactly going on with your pet on that physical exam. And then your veterinarian will be able to implement some treatment depending on what all is found. Let me try get some video of my cat. The next situation, I'm going to talk about times when pets are having difficulty with breathing. So you could notice that your dog is panting more than normal or panting constantly even though they shouldn't be hot, being unable to settle down to sleep. Certainly if a cat ever starts panting, that is a problem. They should not pant. Or you might notice that their breathing rate has become really fast, so their chest is heaving back and forth a lot faster than it normally does. Or you could even notice that they're having to use their abdomen when they breathe, like their whole body is being used in the effort of breathing, including the abdomen, all the stomach area. All of these issues are things that need to be checked out right away. They could be heart related, they could be lung related, they could be something else going on. Even severe pain can cause quick breathing like this, but any of these situations are ones where you need to see an emergency clinic, or if your regular veterinarian has an appointment time available, you need to be seen right away. Potential emergency number 3. If there has been a toxin ingestion. Common toxin ingestions are things like xylitol, human medications, the active ingredient in marijuana is THC, and that is toxic for our pets as well. There are a number of home remedies that you can find listed online, but those tend to be dangerous and not work very well. The best thing that you can do is contact the toxin hotline. They can help you to assess the risks associated with the amount that your pet has ingested, but you should also likely head to your vet clinic right away, because this is time sensitive. The longer the toxin is in the body, the more will be ingested, and the more side effects and issues that you can see. Your veterinarian will have drugs that can be used to induce vomiting, that are the safest and most reliable in doing so, and then they can also start other treatments depending on what type of toxin has been ingested. There are also a number of toxins that should not be vomited back up, as they can cause more damage to the esophagus, or cause aspiration concerns, which can lead to a whole host of other issues. So vomiting is not always the right answer, which is another very important thing to remember, and why you should seek veterinary advice if you know your pet has eaten something that could be bad for them. All right, issue number 4 that we're going to talk about. This is anything to do with your pet's eyes. Eyes can be quite fragile, and issues with them can get very serious very quickly. It's because of this that any eye issues are considered emergencies until proven otherwise. Also, eye issues tend to be quite painful, and so your pet needs to see a veterinarian if something happens to their eyes. Symptoms you might notice at home include squinting. That means that your pet is in a lot of pain if they're holding one eye a little bit shut. You could also see redness to the eye. You could see a lot of tearing from the eye. If there's trauma surrounding the eye, you could see bleeding from the eye. You could see cloudiness. Any change that you note with the eye, really, it needs to be checked out right away. All right, let's move on to topic number 5. For this, I'm going to include bite wounds and other trauma. The reason that these need emergency attention the vast majority of the time is because they need to be properly cleaned out, and because they're painful, this is quite hard to do with our pets. It's not fair to them, and will really scare them and hurt them to try to do it without having pain management and even sometimes some level of sedation or anesthesia, depending on the severity of the wound, on board. And so you need to see your veterinarian promptly, because waiting will increase risks of infection in the wound. And also, the older a wound is, the more limited we are with the ways that we can attempt to treat it. A fresh wound gives your veterinarian the most options for treating it, and it also gives your pet the best chance to heal with as few complications as possible. Issue number 6 tends to be more of a dog issue. Some dogs, especially those with a really deep chest and quite a narrow waist, they have higher risk. So think of like a Doberman or a Great Dane, even actually the Dachshund can be at risk for this one, where they can develop bloat, or even their stomach, instead of only bloating, it will bloat and then twist on itself. This is an emergency and can happen incredibly quickly. So if you ever notice that your dog is acting painful, they're vomiting, their abdomen is swollen and sore, this is a reason to see your veterinarian right away. And if you do have one of those high-risk breeds, it's a good thing to talk to your veterinarian when they are having their spay or neuter. For some breeds, it is recommended to tack the stomach in place at the time of that surgery, because that dramatically prevents the risks of that torsion that we were talking about, and that GDV, or gastric dilatation volvulus, is when the stomach bloats and then twists on itself. That is a very fatal issue, and it is an emergency. And sometimes prevention is the best tool that we have, so make sure to talk to your veterinarian about that. Moving on from something that's more of an issue for dogs, although GDVs can happen in cats, it's quite rare. Something that is more common for cats than for dogs, however, is to have obstructions of the urinary tract, or to have exceptionally painful urination. It can be caused by a number of different reasons. It could be a cystitis or inflammation in the bladder wall, which is very sore. There could be crystals in the urine, which people who have that report it feels like urinating razor blades. It's incredibly painful. There could be bladder stones, kidney stones. There could also be a blockage to the urethra. And this is more of a problem for cats as their urethras are a smaller diameter. So it's very important to, when you're scooping your cat's litter boxes twice a day, as you should be, to be monitoring the number of urinations and bowel movements in there. And if you're noticing that the urination number is changing, or that your cat is going to the box but not seeming to eliminate and then leaving and then going back again soon after, trying some more and then leaving, or if they are vocalizing while they eliminate or demonstrating any sort of pain when they're in their box, this is something that is an emergency. All right, I think we are now on number 8 of our list here. And so for number 8, I'm going to mention seizures. These are important emergencies, as they can, be secondary to toxin ingestions. And if you didn't know that something had happened, seeing your vet is very important to prevent your pet from getting worse. Seizures can also happen with different neurological issues, whether it's tumors or in the brain or other neuro issues. If you are noticing that your pet is having a seizure or a seizure-like activity, make sure not to touch them, because they can be out of it and sometimes they won't know what they're doing and they could bite unintentionally. So keep yourself safe. Move things away from your pet so that they are at the least risk of hurting themselves. And if you can, try to take some video or time how long the event lasts for, and then when your pet has come out of it, because usually they last for a minute or less, make sure that you see your veterinarian right away. And that might mean going to an emergency clinic. It's pretty standard that a blood panel and a physical exam will need to be checked, just to look for what the potential cause of the seizure might be. Depending on what's found with those tests, and immediate intervention might be necessary, or if there have been multiple seizures in a short period of time, or cluster seizures, as we like to call them, that also would indicate a need for immediate treatment. But sometimes if it's only been one and their physical exam and their blood work come back with no issues, we might choose to monitor, but you still need to see your veterinarian if you notice seizure, so that the seizure event can be in their medical record, so that we can rule out a bunch of the common issues that need immediate intervention, and so that you can be given instruction on what to watch for and what to do should another one happen. On to number 9. So for this one, we're going to talk about more orthopedic concerns. So if you notice that your pet is unable to get up, or if they are not weight bearing on one of their limbs, or very minimally putting weight onto one of their limbs, these indicate serious and painful, most often painful issues that you need to see a veterinarian for right away. Some of these can be like disc issues in the back, and those are very time sensitive, as far as the faster that you get treatment for them, the higher the likelihood of a successful return to function. So it is very important for these pets to be assessed right away. We also worry, of course, about like bones that have broken or bones that have tumors. So if you notice that your pet is having a lot of pain with one of their limbs, and again, pain, you might notice that as not wanting to put that leg down, or not being able to get up, or very, very gingerly touching that leg to the floor. All of those are reasons to see a veterinarian. At the very least, your pet needs appropriate pain management, but there could also be something quite serious underlying, and so it's important to have your pet checked out. And finally, number 10. This one is a bit harder to describe in the vet world. Some people refer to this as ADR, ain't doing right. So you might notice that your pet's appetite is way down, or they're really tired, they just don't have the energy that you would expect from them, they have lethargy, they could be unable to settle themselves down, they might be otherwise, you know, just not themselves. And if this is, you know, a very mild change, you know, it could be appropriate to see your veterinarian at their first available appointment. But if this is a moderate to a dramatic change, or one that you notice is getting worse pretty quickly, that is reason to see a veterinarian. There are so many potential things this could be, I won't even try to name them all. So a bit of a conclusion here, this list is in no way comprehensive. There are many other cases where you may need to immediately go and see a veterinarian, but these are some of the more common ones that we get questions about all the time. And of course, the big takeaway point is you know your pet best, and if you are saying, look, something just is wrong, it's always better to have your pet evaluated and to get that peace of mind and to start sorting out what's going on, rather than wait and have serious regrets about doing that waiting. I hope that this gave you some information about some of the more common questions that we get. If you are interested in watching more videos, I do have a YouTube channel called Vet Med Corner, and I just started it, but we'll be posting videos answering questions, and you can comment questions that you would like to have answered, and I might just make a video about it. If you are wanting to ask me a question about this emergency list, I will be attending the Zoom Q&A, and look forward to meeting with you there. All right, take care. Bye.